My name's Herb. I work at the VA. Specifically, I work at the Veterans Service Center. We deal with eligibility, enrollment, and I'm actually a Tricare Champ VA coordinator there. So if you have Tricare, which is insurance, or Champ VA, which is insurance for 100% disabled veterans for their loved ones, I would be the person you would be speaking to. Now, first slide, please. Post 9/11 combat veterans. If you haven't already, within 5 years after you get back from deployment, get to the VA. So this way you can get enrolled in the VA. There's stipulations which if you didn't have any deployments or if you weren't there in the first 5 years, then it's income based. And if your income's too high, you would be considered rejected. Unless you have a service-connected disability, in which case everything opens up to you. The VA covers you from head to toe, except for your teeth. But if you ETS, you get one freebie cleaning or visit within 180 days of ETSing. I'm jumping all over the place, and I apologize for that because there's so much information I can put out there, and I work better on an individual basis. Next slide. Locations. Where are the locations? Next slide. Bingo. The main facility is Buffalo. We have everything there. And if you go to any of the Batavia and Buffalo, Buffalo has the majority of everything, oncology, ophthalmology, you name it, we have it. Batavia has a lot of things too, but they're more specialized towards the long-term care for veterans. Next slide. And Dunkirk, Jamestown. We have locations all across Western New York. Those are called community-based centers or community-based outreach centers. Next slide. Lackawanna, Lockport. Next slide. Niagara Falls and Olean. In case you haven't seen the one on Pine Avenue, it's across from the Como. These are basically used for your primary care. Some of them have mental health counseling, ordering prescriptions, and getting your blood drawn for your primary care visits. And you would go see your primary care doctor. That is the person you would see first and foremost to get any consults, any orders put in. So if you need an x-ray or if you're trying to get a prosthetic, you would see that person first. And it makes it easier having these facilities so you can get to them quicker and easier. Next slide. Springville, that's the last one. Been there before, it's a nice location. All right, requirements needed for VA health benefits. Next slide. Automatic eligibility. So if you have a Purple Heart, you're automatically priority group 3. There's 8 priority groups, by the way. 8 being the higher income or rejected veterans, 7, 6, 5, all the way to 1, which are service-connected veterans. 50% or above is priority group 1, 30 and 40% is priority group 2, 10 and 20%, these are disabilities. So if you have any injuries incurred or aggravated from military service, you would be in those priority groups. Let's see, catastrophically disabled, that would be priority group 4. Service connected, okay, we already have those. If you're medically discharged, you're typically in priority group 3 as well. Priority groups 3 to 1 don't pay for doctor visits. Priority group 1 doesn't pay for anything. So if you're in 2 or 3, you're only paying for your medications that are not service related. Priority group 1, you're not paying for anything. And then catastrophically disabled, you typically only pay for medications based upon your income as well. Let's see, combat veterans, we already went over that. Try to get there within 5 years. If you get back from boots on the ground over there, come back, get your foot in the door with us. Because once you're enrolled, you're always enrolled. And hopefully we don't have any POWs. If you do, thank you for your service, and I apologize for that. But POWs are also placed in the higher priority group. They also get dental POWs. To get dental at the VA, you have to be 100% service-connected, disabled, a POW, or you have to be in vocational rehab. Next slide. Registration process. I have a whole bunch of enrollment packets out there. It's simple. We get your basic demographic data, and then we get your income and your DD-214 or any other papers, Title 10 orders, etc., to get you put in the system. If you would prefer, which I prefer you to show up as well, just come see us Monday through Friday, 8 till 4:30 at the Veterans Service Center. The information is all in those packets if you would like to grab one afterwards. That's the combat vet eligibility again. Has anyone not enrolled and gotten back from the deployment in the past 5 years? Because if you have, please, please, please get in, get your foot in the door. This is healthcare coverage. It satisfies the Affordable Care Act, if that's still going, and this will always be there. You don't have to use it, but at least get there so if you ever need it, it's there. Because life will happen, and the VA will always have your back once you're enrolled. Next slide. Typically, you would come see us. We would create your file, so then they can start putting notes in your file. Veteran status with the VA trumps, so you'll always be marked as a veteran first. Then if you're active duty or you have Tricare, that would be your secondary eligibility. So if you're enrolled as a veteran, then you'll always be enrolled as a veteran if you're qualified as a veteran, which means you'll always have that for the rest of your life, unless you write a letter to the Health Eligibility Center in Georgia and disenroll. But if you don't want to use the VA, just don't use it. But please, please, please have it there in case you ever need it. Because I see a lot of people coming in and they don't qualify anymore. So the 5-year window, if you had a deployment after 5 years, it's going to be based upon your income. So if your income is above, right now the cutoff for this area is approximately $37,700 to $43,300. If your household income is above that, you would be rejected and unable to use the VA. That's why I'm imploring people to come during that 5-year window, because once you're in, you're always in. There's 3 deductible expenses we look for too. So if you have a lot of medical that year, keep track of all your medical and keep all the receipts. So the first $700, $800 doesn't count of your medical expenses. After that, every dollar you spent on your medical expenses deducts from your income. Some people got enrolled because they paid 20 grand 1 year in medical expenses. If you're AGR, you'll have Tricare and they'll be billing you as an active duty soldier, which means you will have no copays, but we will be billing Tricare for your services. I can't speak for any other states, but here in Buffalo, we accept active duty, we accept AGR, people with Tricare. We can't bill Martin's Point, so if you have the Martin's Point U.S. Family Health Plan, we just can't bill them. I don't understand why, that's our billing side. But if they're like us, you should be enrolled, you should be good to go. Get boots on the ground, touch base with their Veterans Service Center, and just make sure everything's up to date. We already talked about the combat vet eligibility, so we're good on that. Recently discharged. Like I said, try to get in there, especially if you're ETSing, because if you're eligible, you have 180 days to get 1 freebie dental, which I missed out on, a lot of people miss out on. And once you sit down with one of us, we can explain a little bit more. We can get you set up with the primary care. We can explain how to navigate the healthcare system. I know a little bit about the benefit side too, as far as putting in for disabilities, the home loans, education, because I've been through that myself. But if we don't know those answers, we can get you to the people that do know the answers in VBA. We're VHA, and we'll get you to the VBA side so they can better answer those. Next slide. I really went on about this, didn't I? Next slide. We also have a transition office. So when you're ETSing, on the first floor, Charlie Wing, C Wing, there's a transition office. It used to be called OEF, Operation New Dawn, but it's transition office now. They have a whole bunch of social workers, counseling, everything you need when you're transitioning from military life to civilian life. They also have a whole bunch of information. I'm not sure exactly what they have, but we send people over there if you're looking into the service dogs, you name it. They have a plethora of information and services that they provide there as well. Champ VA. So if you do not have Tricare and you're 100% service-connected disabled from military service, you can cover your loved ones for free. You have to be permanently and totally disabled for free with what's called Champ VA. Champ VA is insurance as well. It's much like Tricare, but you can't have Tricare because Tricare trumps Champ VA. If that is the case, come see myself and my partner Jane, bring your service connection letter, marriage certificate, and any other health insurance cards, and we'll get them enrolled in Champ VA for free. As long as they don't have Medicare, they can utilize the VA as well. Once they have Medicare, they can't come because we can't bill Medicare. We would help them transition to outside care. Next slide. Tricare, we bill Tricare. If you're active duty, you don't pay any copays. If you're Reserve, Tricare Reserve Select, you pay your typical copays. We're in network with Tricare, as well as we don't haggle with Tricare. Some doctors behind the scenes haggle for how much a service is worth. Tricare says it's only worth this much. We agree, and you pay the percentage based off that. So it's one of the more cost-effective places to go if you have Tricare. Next slide. Burn pit. So if you were deployed, please, please, please get on the registry. It's just a registry right now. They're trying to link illnesses, diseases, anything associated with that. They're working on respiratory. There's a whole bunch of things that people are starting to come forth with because of their deployment. So, much like the Agent Orange, at first there wasn't too much information about it. And then people's names were on these registries. Once they were on that registry and they finally associated it to military service, they were now service-connected veterans receiving disability pay. So, get put on that just in case they find out something you were exposed to is causing your health problems in the future. Next slide. Contact information. If you want to take it down, we have the Veteran Service Center for general questions, and I'm a Tricare GMPA coordinator. My information's on there as well. Service connection disability. The easiest way, have a diagnosis and treatment records ready, outside or inside the VA. If it's inside the VA, it's easier for them to track and coordinate, get the records. If not, find a VSO. We have the DAV, which is at 130 South Elmwood. The Purple Heart Association is also there. There's state representatives on the 6th floor at the hospital. Basically, you sign over power of attorney, which allows them to fill out the paperwork for you and start submitting claims. They try to associate, if you had a shoulder injury, it may also be causing peripheral neuropathy. So you might have just put in for shoulder injury for yourself, but they try to link other things that may be associated as well. The VSO will submit this paperwork for you along with any evidence provided. And if it gets the thumbs up, you go on to the compensation and pension evaluation. You're going to get a phone call usually within a month or two. They set you up with a doctor who's going to evaluate that injury. And then based upon how disabled you are, they have a database questionnaire. They're called DBQs. They check certain blocks, and if you're yes on several of those blocks, that's when it goes to the raters. The raters then, based upon what the doctor put down during that evaluation, assign the 10, 20, 30, 40, 50% rating. Bring your stuff to release of information. They can scan it onto your file, or if there's anything really pertinent, like this is really gonna help your disability case, have copies of it for when you're submitting for the disability. But by all means, get a copy of your records and bring them to our release of information and have them put into your file, or just keep them for yourself as well for future reference. You can get them put on a disc, but if you're taking it to another facility, we're not allowed to accept any CDs or thumb drives. You can have it placed on that for your own personal information or a facility that would accept that, or you can get the hard copies. If you just want the last year, once again, go to the release of information on the first floor at the hospital in the C wing. 103 Charlie is the room number. Go there and just place a request. You'll have to provide identification and they'll give you your stuff. Some of us, to include myself, have access to JLV, which is Joint Legacy Viewer, which allows us to see some of your treatment records from when you were in the military till now, but not everyone has access to these systems yet, and they're slowly working on the transition. There's always going to be a period of adjustment, but like I said, always keep your own stuff. Keep a copy for yourself just in case. Just like the new ID card. For people that don't qualify for the Veterans ID card, they're creating another one on vets.gov. You're supposed to go on there and register. You're going to need a driver's license and a social security card, I believe. And it was supposed to roll out the 1st of November. They pushed it back to the 20th because there was software issues. You go on there, you register, you get a Veterans ID card as well, just in case you don't qualify for our ID card. When in doubt, Google out. Anything that says va.gov and then has all the extra wordage after it is typically the best source. For example, Google Southwest Asia conditions. If you were in Southwest Asia, you were exposed to a lot of different things, and the va.gov publications has that. Leishmaniasis, malaria, dengue fever. You can do Agent Orange. You know there was Agent Orange stateside sprayed on some of the bases, and there's time frames. So if you're ever looking for it, and there's a va.gov in front of it, that's typically the source you want to be relying on. Thank you very much for your time.